We're learning more about the president's recovery from COVID-19. In a new statement, the White House says Biden's symptoms have improved after 1 day of taking Paxlovid. And the statement adds that he continues to experience some mild symptoms, as Mary just told us, that cough, fatigue, runny nose. Looks good at this point. For more, let's bring in ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel. Dr. Patel, good to see you. So, is this to be expected, do you think, as President Biden goes through this process? Is Paxlovid, it worked that quickly, or is he just kind of, at this point, bouncing back?
You know, Terry, I don't want to speculate beyond what Dr. O'Connor kind of presented in that statement right now, but it really does depend on the individual, even going beyond what President Biden's situation is. You know, the average person out there, if they meet criteria of being high risk above the age of 12 or being at an older age, should be taking Paxlovid on day 0, especially if it's recommended by their physician. Now, it is obviously great news, according to this letter, that President Biden is doing well. I don't want to go beyond that and predict what could potentially happen, but all of us are happy to see that this is on the right track. I think an important note for people out there to understand is that if you are in a situation where you should be taking Paxlovid, to make sure you chat with your doctor, exactly how President Biden did, because there may be some special situations, including medications, which you may need to hold while you're taking that drug.
And I want to follow up on something you just said. Obviously, we know that this virus hits people differently, and we know there are comorbidities. But do we know how it works? In other words, there are some 79-year-olds who get it and are fine after they've been vaccinated, some who aren't. Some 30-year-olds get it, fine, some who aren't. Do we know why? Have we got any insight into this at this point?
You know, Terry, we have a lot of insight in who is at higher risk of progression to severe disease. And we have the data to show us everything from saying that the vaccines over time have proven that they're fully capable of preventing severe illness, progression to winding up in the ICU or dying. We also have the data, including from the CDC, showing us that patients with certain chronic medical conditions, such as hypertension, COPD, asthma, diabetes, obesity, are also at higher risk. But to the very first thing you said, it's hard to predict exactly how an individual is going to do, which is why we all need to still take it seriously.
And finally, let's take a step back from the president. As you say, you know, will depend on the White House and on the president's physician to keep us posted on that. But on COVID in general at this point, this BA.5 wave, how concerned are you? We see a lot of cases, hospitalizations, and thank God deaths considerably lower, but places like Los Angeles are going to reinstitute a mask mandate. How do you read this current wave and how it'll impact us?
Well, you're right, Terry, that the progression from cases to hospitalizations is down, partially based on kind of this immunity wall we have between vaccines and natural immunity. But listen, even if we have a small percentage of cases winding up in the hospital, when we have so many cases, hundreds of thousands a week, we inevitably will see some more hospitalizations. And Terry, death is not the only metric we should be paying attention to. People can still wind up severely ill, spreading the disease onto others, and or getting long COVID. And these are all things we have to pay attention to as we're dealing with one of the most contagious viruses we've ever seen with BA.5.
All right, well, let's hope we get through it all together and get to the next one, I guess. Dr. Alok Patel, thanks very much for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.